So let's log in to Insight Go. Make sure you can do it. Saves. And then go down to this one. Should pull up something like that. And go to dashboard. And if it asks you to log in.
It says download extension.
Yep. Download the extension.
In the app.
Yep. And then that extension will live up here in the puzzle piece area. And typically it's pinned. You really don't need to know that it's there. It always is running in the background. But your login, you can just create a login based off of your IRG email address. So it's first name dot last name at irgpt.com, and then whatever you want to make up for your password. So how you use this is you have things called snippets. You can create anything that you want, title it anything you want, but basically you see where it says \S1. If I type in \S1, that text comes up. So you could be typing away at your note and you're like, oh yeah, I did kind of the standard, like nothing crazy happened in treatment today. So I'm going to start with that. Patient was able to progress through all exercises without an increase in pain. Patient needed verbal cueing to progress through all exercises without pain. Form was monitored for correct activation, and response to load was also assessed during rest breaks. And then you add in your color commentary of what specifically happened. Like I tested like right rotation in the cervical spine. It was slightly limited, so mobilization seemed to increase that. Whatever you want to say. Mm-hmm. But at least it saves you from typing this part in.
Yeah.
Because when you put in a snippet, try and just keep it as generic as possible. Don't use he or she, just use like they. Mm-hmm. That way it's applicable to anyone. And like I said, you just add on documentation after that describing what you did specifically that day. Yeah. But that'll at least save you like 50%. And then in the subjective, you can also have a subjective that you typically write, and then maybe there's a couple words that you would change from day to day, like whatever your typical statement in your subjective is, and then you just change the end part of it or something like that. So the way to add them is you go to the plus sign and then create snippet. It creates this. So you can change your shortcut to whatever you want. Change the title to whatever you want. Usually describe what you're going to put in this text area. And then the text is whatever you want popping out if you hit \DOS. And you can do that within any note. It automatically saves, so you don't have to hit a save button or anything like that. But yeah, so that should save you some time. My recommendation is you finish a week's worth of notes, and then after you're done with that week, you go back to those notes, and then you start copying and pasting things into text plays.
Yeah,
that way you don't have to do it twice.
Uh-huh.
And you don't have to really think very hard because you're doing it for those notes. Any questions on that?
Mm-hmm.
Okay, cool. So the next thing that I want to get out of the way is our WebPT Reach login, and we use that for home exercise programs. Okay. So I'm going to pull it up on my screen. It's going to look like this. But for you guys, go into your email and search for reach. Click on the reach support. And then there should be a sign in or sign out. And then put in a password, whatever you want. Okay, now
Probably add that to the bookmarks as well.
the reach side of things. This is our patient engagement. Most of the time it's for clinic directors or managers. They'll look and track NPS scores and things like that. So for example, this person, you can see where they're going for PT, if they've had any communications, NPS scores, emails sent out, all those sorts of things. For us, we're going to go to this down arrow by our name, and then go down to WebPT HEP. And tell me when you get in there.
Yep.
Okay. So this is the home exercise program. So it's pretty standard. If you've used WebPT before, it kind of follows their typical pattern, but just to give you an idea of how IRG uses them, typically you're going to try and find the patient first. So let's say, for example, I'll do that. And you're going to go to their file. So the reason I recommend doing this first, if you do a bunch of exercises, then you search for the person and you hit create, it'll create an entirely new active plan of care for them. And that kind of gets a little messy as you go along. You always want to edit the current plan of care unless it is truly a new plan of care. So this is a previous plan of care that I had. You go to the stylus, the edit plan of care. That brings up all the exercises that you've given any patients. So you can either drag onto the plan of care, you can click add. Once it's over here, you can click on the picture and you can add sets and reps or whatever the case is. Change the description, whatever you want to do. If you don't find an exercise that you want, you can go to a blank exercise, add that. And from there, you can type your description or whatever you want to do to add it into their program. So, little thought on these phases. You're only able to print out or see the phase that's selected, and the patient is only able to see whatever's selected. So if you have 3 phases here, and you get to that by adding phases, they're only going to be able to see whatever you have selected. So what I would recommend is probably just having 2 phases. One is kind of the phase of these are all the exercises that you add in within the first week or 2. And then the second phase is going to be you just drag in the exercises that you want them to do going forward. And then once you're done with an exercise, you just pull it back into phase 1 so that the patient's only seeing the up-to-date ones, but you always have this other one to pull from. That way you don't deselect it and delete it, and then you're oh, the next visit, I want that back. You don't have to go hunting for it. It's just right there in your phases. And then you just go to Update Plan of Care. And then you can either print it or save it. It automatically emails them a link to their portal. So you don't really have to worry about emailing it to them unless they're having some sort of significant issue with their portal.
That's when you hit Submit Care Plan?
Yes.
Okay.
Yep. And then if you're, like I said, if you're searching for a patient, you just search up and through there. So for this part, you don't need to do anything. I'm just going to kind of talk you through an evaluation, daily note, progress note, discharge note. If you have any questions along the way, just let me know. Okay, so when you're looking at your schedule, you have a couple things that you want to double check, and we'll make sure that your schedules are good to go before you leave today. But just to give you an idea, you have your selection of your therapist, so that would be like right up here. You can select yourself, or you can select everyone at the clinic. The clinic is right here, so you'd want to select your clinic that you're working at. You have hide unavailable staff here, and then condensed view here. So you want to make sure about that. So you have hide unavailable staff here. What that means is if you say select all therapists, it'll automatically like hide the ones that are not working on that day. So that's pretty helpful if you want to see like who's coming in at what times in the clinic. The hide failed appointments tab, that's like cancellations, no-shows. If you just don't want to see those, then you can click that box. And then the condensed view is what I recommend unless you have eye trouble. That way you can see all your patients all in one screen.
Yeah.
So this is blurred out here for patient confidentiality, but the green boxes here are arrived patients. The pink box is going to be a cancel or a no-show. Yellow is you've highlighted that patient. Blue is like a lunch break. And then gray is just a meeting blocked out time.
Like purple is eval, and then
Okay, so over here on the left side, when you click on someone's name, it'll give you a description. So the patient's name is up here, date of birth. Any pertinent information will be right there. And then down here, bottom left-hand corner, you've got a couple different options. The one with the stylus is the one that you can view patient chart. And then if it's a new eval, it'll bring you directly up to this pick a template section. So in this situation, you will pick a template. And most of your templates, if not all, will be under the musculoskeletal evaluation template. And for this case, we'll just pick a shoulder, click apply, and then you just pick left or right shoulder. Click apply, and that'll bring you up to your evaluation note. So with an evaluation note, what I like to start with is the summary area. The summary area is basically there to put in any information that you wouldn't put in any of the boxes. You try and use the boxes as much as possible because they're the most modifiable, and they also have the most text already put in them. So again, it saves you a lot of time just clicking around as opposed to having to type in text. The summary area, to give you an example, I typically put in like parents' names, or like they go to this high school, or their dog's name, like stuff that is like color commentary to who the person is. That's not really applicable to like their physical therapy side of things. So I'll type that in. And after that, you can see that there's some yellow boxes and some blue boxes. The yellow boxes, you have to have something in that box. The blue boxes are optional. So to complete a note, all the yellow boxes need to be completed. So make sure that you get those completed. You can click on the triple dot, select something, or you can click on the box and delete it. So even if there are a bunch of options to pick from, you don't have to pick any of the options. You can just click on the text field and type in whatever you want. But again, Just clicking usually is faster than coming up with your own text. So notice there's a lot of different text boxes. Don't feel the need to click on all of those, but once you click on them, they go into your note. If you don't want them in your note and you've clicked on them already, you can unclick the box, the little check mark over to the left side. So the first thing that I usually do is kind of click down to the pain rating scale and then enter all the different pain levels and then make it a goal, which you right click on the text and then that'll auto-populate your goal field. And then you need to select a due date for that goal. And usually I like to select a time that matches up with what I think my plan of care is going to be. So usually my plan of care is around 8 weeks. So I'll usually pick a date that's around 8 weeks from whenever I did the evaluation. And then click apply. And then you do that for any box that you feel like you want to make a goal. So there really isn't a defined, like, I need to type out a goal. You can turn any box into a goal by right-clicking on the text and turning it into a goal. So again, you can type in anything you want, make sure that the yellow boxes are clicked. And then functional deficits, I typically like to have 2 functional deficits in, at least. And this is where you would type in something like patient is unable to walk, or patient is unable to walk more than a mile without knee pain, or something along those lines. I think in this case, I did patient is unable to reach the top shelf of a cabinet. Patient is unable to reach behind the back to be able to take a shower. So again, you copy that, highlight that, paste, and remove the UN, and then that makes it a goal. When you do submit it to insurance companies or documentation, it has a separate category of goals, so it makes it really nice for insurance companies to see your goals and what you're working on. Another category that we'll use frequently is the patient-reported outcomes. So you'll go to this Heat Health up there at the left-hand side. It'll pull up the screen within your note, and then you'll typically have an outcome there to pick from, and it'll tell you the number. So you just have to remember the number and then put it in this square there.
Because they can take this like in the waiting room.
Yep. They'll usually be handed an iPad, and they'll fill it out, and then it'll automatically get put into the note. Okay, and now the objective section is usually the most daunting section of any EMR. There's just so many choices. You cannot filter it out like personally. It's company wide, so you just have to kind of understand where the areas are that you typically use. So after about a week or two, you'll kind of understand where things are at, and like it's a lot faster. But again, same deal. Don't feel the need to click on absolutely everything. Just think about your documentation, what you want to put in the note, and stick with that. Don't get derailed by all the other things. They're like, oh, yeah, I should put that in there. Or like, oh, I should test that. Like, just go with your clinical judgment and then just put it in there after the fact. So then you just kind of go down the list of all the things that are applicable. So your typical like right, left fields, you can make a goal on anything that's here. So let's say you're doing shoulder passive or shoulder flexion, active range of motion. You can make this a goal by right-clicking on it and entering what your desired goal is. So if you want it to be 150 degrees, you can enter that. for Medicare patients, you need to enter evaluation complexity. At the very beginning, when they first rolled this out, it was like you needed, so like for low complexity, it had to be like 30 minutes or lower, like no comorbidities, and like there's this like graph almost of what you could put where. Now they just leave it up to your clinical determination. Like it should probably like show a picture of a complex patient if you're going to pick the high complexity, but you don't have to spend 90 minutes face to face with a subjective to get them in that category. Some people, they just walk in and you're like, okay, well, your body chart has everything circled and like you're walking, your gait's bad. Like, I know this is a highly complex patient. I don't need to spend 90 minutes trying to figure that out.
Right.
So don't let that be your determination. But within this category, you're most likely going to want to add a few notes here. So if you say number of personal comorbidities and you say 1 to 2, you're probably going to want to have 1 to 2 comorbidities in the note section to like validate that. If it's not in the note section, if you put 1 to 2 body parts, for example, we're going to assume that somewhere in the note it says that there's 2 body parts, like the 2 body parts that you're talking about. So you don't necessarily need to put it in the notes there, but it is one of those things that if you want to keep it a little bit more concise for the next person, that if they're treating your patient, they can just look back and say, oh, here's kind of the highlights of it. It's just a good section to be able to go back. Okay, so after doing that, going to the assessment category, you have a variety of different pre-populated things. So pretty much everything in assessment, before you start typing in it, you want it in your note. So you have all this boilerplate stuff that needs to be in there. So you just click the include all displayed items, and then you're probably going to want to add a shoulder diagnosis, like shoulder PT diagnosis. So say something like shoulder instability resulting in supraspinatus tendonitis or something along those lines. And then you can change the rehab potential to whatever you think is appropriate. And then you get to plan. So plan, again, you're probably going to want to include everything. So include all fields. And then twice weekly for 8 weeks. Remember when I was doing my goals, they were 8 weeks long. So that's why I put the 2 times a week for 8 weeks. This will be the section that you update when you are doing a plan of care. Okay, so the next section that takes you a while is procedures and supplies. So supplies is pretty easy. Just go up here to the plus sign and then click on PPE, personal protective equipment, and then click this option. And then that'll pre-populate there. The other section is the procedure section. You click add. And then evaluation. Mine was low complexity, but you can do low, moderate, or high. And then you can do procedures. So you're basically just clicking the options or the fields that you want to have in your note. So active range of motion, passive range of motion, manual therapy.
For that day.
Yes. Yep.
Okay, we're billing.
Yep. So it's all in one. So this would be an area where you're adding in how much time you spent on something, you're adding in the descriptor of the exercises or the manual therapy technique that you used. This is kind of like the meat and potatoes of your treatment side of things, but it does get converted into billing through however many minutes you.
Oh, okay. Kind of does it all in one.
Yep. So it is a lot, but it does a lot too. So you're probably going to spend most of your time filling this out on the eval, but after the eval on the daily notes, it gets pre-populated for whatever you wrote in. So it makes life a lot easier going forward. Yep. So with manual therapy, you want to make sure that you put what position the patient's in, the direction of force, the strength of force, location that you did the manual therapy to. Patient education is not like your true patient education. It gets billed under therapeutic exercise or therapeutic activity, depending on what you're talking to them about. I have a hard time making the call that you would do anything other than therapeutic activity as a billing for that. So that's why that's the default for it. Because you're usually talking to them about, okay, you're going to be doing your home exercise program, and then how are you going to filter that into your day? And is there anything else that you're doing around the house that we need to factor in? Like all that sort of stuff is the patient education side of it. And I use a TextBlaze snippet for that. And you can see it says discuss prognosis, activity modification, and home exercise program. So I just found myself typing that a lot. So I just put that as like a snippet. So it didn't take me very long after that. Active assisted range of motion. I basically wrote in what sort of range of motion I did, but noticed that there's sets, reps, and load for like the strength training and functional training. There's nothing there for active range of motion. So you'll kind of get an understanding of what sections are appropriate for what you want to include. So strength training is usually a therapeutic exercise technique. Functional strength activity is going to be a therapeutic activity technique. And you can change the CPT codes over there to the right. If you accidentally selected functional strength activity and you're like, oh yeah, that's actually going to be a therapeutic exercise, you can change the CPT code to that if you want. It's completely up to you. So again, with the descriptors of what you did, you want to have, if you're a therapeutic exercise, you want to have the exercise that you're doing, sets and reps. You really don't have to do much more than that. If it's a functional strength activity or like a therapeutic activity, then you want to do your sets and reps or the amount of time that you spent on that exercise in actual activity. So say I put, go back here. Say I put 8 minutes here, and over here I write down that like bilateral external rotation with red band, 4 minutes. I'm going to assume that that 4 minutes is the amount of time that they spent doing the exercise. 8 minutes is like you showed them the exercise, you set them up with the exercise, you maybe did some corrections. So like another term is time under load. I don't know if you guys have ever heard that before, but it's basically the time you spent loading the activity or loading the muscle. So make sure that you have a descriptor of either sets or reps, time under load, or just time doing the exercise.
And time under load, would that be, we put that in notes? Then?
Yeah, in notes. You can just put capital TUL if you want.
Okay.
But whatever is your typical workflow or what you like doing.
Would you bunch multiple exercises?
So
Or you
yes,
add individual boxes?
either one. So it kind of depends on your support that you have at the clinic. If you have aides that help you with your exercises, you're probably going to want it to be more individual exercises because inadvertently you're probably going to be doing some of those exercises. And once you hand off the chart to the aide, you want them to have a clear picture of what's going on. So the process of handing off a chart to an aide, they should have a computer or something that they can see what clinician on. So you go up here and hit the save button right there. And that'll save it. It does auto save, but just because you're probably going to stop doing that note at that point, hit the save button and then have your aide load the patient chart and then bring it up at that point, and then it'll be the most up to date. But basically, you're going to have a whole bunch of exercises for a daily note, and you just, as you're going along, you click the check boxes to signify that you're done with them. The one caveat is if you're doing like multiple exercises that you know you're always going to do them together, like let's say like saws, rows, pull downs, all with the band, and you always do those kind of like right in a line, you can cluster those and just say time under load 10 minutes or something like that. And that way you don't have 20 exercises on there.
Yeah.
But I definitely wouldn't put all your exercises just in one.
Yeah. So each time you want to add a procedure, you just hit add.
Yep. Yep.
Okay.
And again, you can add a goal by right-clicking on anything and clicking apply. It'll have presets in it for range of motion, but sometimes those presets are pretty off. Like it'll say like 90 degrees of external rotation. Maybe you don't want that. Maybe this person has no capability of getting to that. So just be careful with that. And then you always want to double check your minutes, because this is where billing comes off of. So what we're looking for is up here. It'll tell you the amount of time that appointment is scheduled for. So like in the schedule, it'll either be under like 30-minute time blocks or half an hour or hour time blocks. It auto-populates that here. And the time in, time out is populated off of whatever it says in the schedule. It has nothing to do with when they were checked in or anything like that. So we don't really think about this at all. We just kind of ignore the time in, time out. That has no bearing on our note, and it doesn't come up anywhere on the note when you submit it anywhere. So it's only this treatment time and appointment time that comes across on the note. So let's say, for example, you have a patient that, let's say middle school kid comes in, you do the evaluation, you have 45 minutes blocked out for the evaluation. So your appointment time is default at 45 minutes. Kid comes in, you evaluate them, you get done with everything that you needed to do, but it took you 45 minutes to do that, and you've got another patient. So you're like, all right, well, I'll put your home exercise program together and like email it to you. So like, okay, great. And then they leave, and then their parent comes back in and is like, hey, what happened today? And you spend 5 minutes talking to the parent about whatever happened during that day. Like, I got to go. I've got another patient, but I can send you a summary of what we did. And then after the end of the day, you're putting together the home exercise program. You email them with the summary and the home exercise program, and then they send you an email back saying, oh, I need a get out of gym letter. So all that time is billable time. Even though they're not right in front of you, that makes no difference. You're spending time on that episode of care, so it gets billed to whatever episode of care you're designating that time to. And from a billing standpoint, you don't need to necessarily have a separate section saying like sent a note to the doctor or anything like that. It's just you're billing under whatever the most appropriate time is. And if it's just a general summary of the visit or like the home exercise program, you can distribute those minutes throughout all the units if you want. And Clinician makes it pretty easy, because not this screen, but the next screen will just tell you how many minutes you spent on therapeutic exercise, therapeutic activity, and you can just change that to add however many units you want. But you are going to have to expand on that treatment time section and the appointment time. Because if you have an hour of treatment time, but your appointment time is still at 45 minutes, it won't let you sign off. So on that next screen, don't worry about the time in and time out. Just put in the appointment time big enough to fit in however much treatment time you supplied for that data service. So it's not uncommon to have a 45-minute blocked out time, and that's your default treatment time, and then you have to change it to like 65 minutes because of what I just said. So very rarely do you keep the treatment time at 45 minutes, but that's just how the programming is set up.
Yeah.
So as you're going along, the commercial insurance billing system versus Medicare. We bill under the methodology of commercial insurance, and then if it happens to be Medicare, then clinician just changes it to whatever to fit those rules. So for example, if you have a patient that is a Medicare patient and you bill like 8 minutes of therapeutic exercise, 8 minutes of therapeutic activity, 8 minutes of neuromuscular reeducation, 8 minutes of manual therapy, that's 32 minutes total. In commercial insurance, you get 4 units. In Medicare, you get 2. So if you just bill it appropriately for the commercial insurance and it happens to be Medicare, you don't have to worry about that. It'll just get billed 2 automatically. There's no modifying of minutes. It's just how many minutes did you spend with the patient? It makes no difference. But I do want you to think critically on how you're using your units to most efficiently bill for commercial insurance. If it happens to be Medicare, then it doesn't make a difference anyways. But if you bill under Medicare and you're like, oh, I'm going to like do the rule of 8s, you're probably missing out on the commercial insurance. Does that make sense? Okay, cool. And clinician makes it pretty easy to see that. So you can modify your minutes here if you want, or you can wait till the next screen, which is after you click this stylus, it'll ask you what diagnosis code. You can put in the text of like right shoulder pain or rotator cuff injury or whatever you want. And then you click the box. If there's multiple diagnosis codes, don't hit apply yet. Area where it has the orange, that is your unsigned notes. So whenever anyone gets arrived in the system, it automatically goes to the unsigned notes category. So if you want to just go to unsigned notes to see which ones you have to finish, you can do that. You can go directly to the calendar if you wanted. But for this person, went to the unsigned notes. You can also review previous notes. If they have that like black lock next to them, you just click over there on the note. If it has a red lock, then that's still unsigned. So you need to go to the unsigned note to fill that out. Just a little word of caution with regards to the goals that you make. It's going to assume that if you don't click on the goals, that you didn't do it that day. So if you look at the screen, see how, I'll scroll back. So see how it's blank? Those goals still exist in your overall note, but because I didn't click on them, it's not pulling it through to that specific day. So I would argue that pretty much every visit we go over the goals that we set. So I would click on those goals so that they pull into the note. But from an insurance standpoint, they're going to be there if you had to submit your documentation. It's more giving an accurate interpretation of what you did that visit. So those are all the goals that I made. I can hit the select all goals up there. I can click on the green text if I wanted to, whatever is the easiest for you. But I would recommend clicking pretty much all your goals unless you really didn't check them on any given day. Again, you've got this section in the assessment category that all those are still needed to be in there for insurance purposes. So you can click the select all section, and that'll pull all that stuff into the note. And under plan, you're going to hit add. And then this is where you add your plan of care. So you select plan of care. All those categories are going to go into it. So frequency, duration, home exercise program. You can deselect other instructions maybe if you want, but it'll pull in 2 times a week for 8 weeks. Since that's what I did initially, I can probably change that to once a week or as needed, or I could just write something in there as well. So I could say something like, will be twice a week until symptoms are consistent, and then down to once a week if you treat that way. And then it also includes the treatment procedures, plan of care discussion, and then you're down to procedures again. So you can see everything got pre-populated. The things that I've done already are checked. So I just need to check those other ones, but if you're handing that off to an aide or something, they would know which ones you've done and which ones you haven't done. And then I'll go through that and just update that to make it a little bit more clear. See, I'm adding sets, reps, descriptions, all that sort of thing. Then after this, I'm going to make sure to add that supply charge, because you can see that it's not underneath there anymore. You go to the plus sign, supplies, apply, add, personal protective equipment, and click apply. I favorited it, but it's the top one every time. So
you use it
every visit. Yeah, every visit should be on there. Okay, and then I just go back up, make sure that everything is documented appropriately, minutes are documented appropriately, or as close to what I want as possible. And then if you are doing a progress note or a discharge note, you're going to want to go back to your goals. So you go to the text of whatever goal you want, right click, edit goal, and then it brings up this where it has your goal due date. You're going to update the goal due date and then mark the progress. So if it's completed, if it's a discharge note, you write completed down here, you click that box, and it kind of stamps that as completed. If it's a progress note, there's a bunch of different options like progressing as expected or like declining, stuff like that. So you want to make sure that you update all of your goals, the note there, and you put it into the note. Usually on progress note and discharge note days, you'll have a new number to put in there. So just FYI, and then update your objective measures, your objective goals. Go all the way down, make sure that everything looks good. And then you're double checking your units to make sure that you build appropriately and you don't have a situation where, like that therapeutic activities, it says 22 minutes. Were put in place basically through COVID because we're having to kind of adapt different technologies and things like that. And Medicare decided that, oh, this is interesting. The people that have all these platforms set up to communicate with patients and give them home exercise programs, they do a lot better than the clinics that don't have that. So we should probably incentivize that. So now they're paying for the platform. They're paying for the cost to discuss the platform with the patient or whatever home exercise program instruction that you give them. The overall maintenance of having that platform, like monthly fees, things like that IRG has to pay, and then us going over the platform and communicating with them on home exercise program, things like that. So there's 4 basic codes to bill, which is extremely easy. The complicated part is they have different time frames in which you can bill them. So to do an initial evaluation. So basically you perform the evaluation, collect the outcome measures, set up HEP and WebPT, and then they start the clock on the RTM code. So collecting data for Medicare is the key part of it, where they do it on the iPad. So we're getting paid to do that because there's a cost associated with that. And then the HEP part of it with WebPT. Then on day 16 to 30, so if you don't see the patient till like 3 weeks, well, you're going to be seeing them along the way, but within this time frame of 16 days to 30 days, there's going to be a time where you see them. So it could be day 16, it could be day 21, it could be day 30. Then you bill them for that second code, which is, and then 30 days after that. So let's say that you bill that at day 21. 30 days after that is now your billing the 7/7, and then so just to clarify, this is only Medicare patients for now. But you perform the initial evaluation, they fill out their key intake for functional outcomes. You set up their account in HEP and WebPT, which happens automatically. And then from the time of your initial evaluation, setting that up, 16 days approximately after that, you can bill for 7/5, 7/7, and 8/0. You're probably not going to bill 8/1. Same thing, 30 days after that, you've got 7/7 and 8/0. You're probably not going to bill the 8/1 unless you're spending a lot of time talking to them.